You're trying to improve your gut health, these are the steps. Why we have got poor gut health is because bowel, particularly the large bowel I'm talking about, is roughly 6 feet long, and inside the abdomen it is coiled like a garden hose pipe. Now, normally the bowel goes up all the way from your right iliac fossa, which is the appendix area, to all the way to your diaphragm. Yeah, the rib cage edge where the bra for the female sits. So the gallbladder area is called hepatic flexure or gallbladder flexure. Then it hangs like a necklace like this called transverse colon. Yeah, and it can go up as low as your pelvis and then go up all the way to the splenic flexure. Okay, spleen is on the left hand side of your abdomen. If this is your abdomen, this is your gallbladder, this is your spleen. Okay, and this is your pelvis, this is your appendix area. So it goes all the way up there, like there, up there, and then it comes down. And when it comes down, it kinks. It's called sigmoid kink or sigmoid colon, and that acts as a pinch cock, like a kink. And for some patient, the kink can be really tight, and as a result, the stool will pile up above the kink, and the stool will only open the kink when the stool pressure is really good. There is a lot of gas formation because of fermentation by the bacteria, a lot of really bad cramp on the left hand side, and then suddenly it will open. And when it opens, sometimes it fails to completely clear the backlog. So it opens and you will have an urgent motion, explosion, a lot of fluffy stuff, maybe some solid and fluffy, and it's normally black because it is old blood rather than green, which is fresh stool. Did I say blood? Fresh stool. And all the yellow is bit mature stool, then the brown proper stool, and then black is like a really old stool. The stool should be soft, like a soft sausage, but sometimes it can be porridge, which is just a stuff that comes out like an explosion, not a good quality. And sometimes it can be even liquid because the kink may be so tight that only the liquid can overflow, bypass it. So even though the patients are telling me, I'm having diarrhea, I'm having diarrhea, you're not having diarrhea. What you're having is overflow, false diarrhea. You're actually bunged up in there. Some patients say, no, I'm having pain in my gallbladder area. And they have already had their gallbladder removed because some surgeon at some stage found a stone, or maybe said, okay, let's remove the gallbladder, etc. Anyway, still they are having pain, post gallbladder, post cholecystectomy syndrome. And it's still debatable what causes that. But remember, this kink can be here, can be here, can be here, but mother of all kink is here. So what do you have to do? Unkink it. So once a week on a Sunday morning, or maybe once a month on a Sunday morning, just make it a Sunday ritual because this is my Sunday. Just flush your bowel. I call it Epsom flush. Epsom because this was a household thing. Everybody used to take Epsom for constipation to kind of make their bowel go. It's magnesium sulfate. It's very effective. And caution is always check with your GP. Can you take Epsom salt? I mean, for majority, if you're doing one off every Sunday or one off every month, it should be fine. But kidney problem, etc., high blood pressure, just check with your GP. But believe me, it's just one off. It should all pass away. You're not going to absorb it. It just goes out. But still check with your GP, check with your doctor. So take 250 ml, which is this one big cup, and put 5 teaspoon level teaspoonful. And again, you never know how you're going to react. You may need more than 5 teaspoonful, you may need less than 5 teaspoonful, but start with 5 teaspoonful. And medical options, this is home remedy, no prescription. Go to Boots, buy it. It's extremely cheap. And you know what, this is also very good for skin. So if you make a bath, put it in and soak in a hot bath, joint pain, skin problem gone. This is more kind of community situation. In the hospital, we unfortunately do not have Movicol. We use Laxido, another brand. They're all same, all equally effective. This is from Norgine. There is no kind of vested interest here. So it's just one of the popular brands. So you take 5 Laxido, again on a Sunday morning, and take a dump. How much? They said 125 ml in each. Now for impaction, they suggest we take 8 sachet in 1 liter and consume the whole thing over 6 hours. But I think you just get it done ASAP. When you wake up from sleep, stay indoor for maybe 5-6 hours, and you were expected to have multiple evacuation, boom, 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 and then you're all clean and happiest person in this world. And then you have to repopularize the gut with some bacteria, lively friendly bacteria. So it is kombucha is a fermented tea, because some of my patients, they don't like milk, so yogurt is an option, the least effective option. Kefir, again, a fermented milk, a Bulgarian East European drink, much better than yogurt, much more, many more bacteria. And this is the kind of, real deal. Fermented green tea, fermented black tea is all there. Again, just 1 cup every day, that's your bacteria. And then you need to feed your bacteria. And this is a smoothie. It has got kale, it has got spinach, it has got kiwi, it has got mango. You're not eating this for yourself, you're eating this to provide food for the bacteria. Then those bacteria will make all this lovely chemical, serotonin, etc., to keep your gut lining healthy. They're good, no breakage of the lining, the defense is okay, the mucus layer is okay. So you put it in a NutriBullet or a Breville and make a smoothie. Again, drink 1 cup. Okay, so 1 cup of prebiotic, 1 cup of this every day. And this is a weekly situation. If you're symptomatic with IBS type of symptoms, which can be discomfort, bloatedness, distension, pain in the left iliac fossa, change in bowel habit, sometimes you're going too much, sometimes you're not going, uneasiness, sometimes gas will rise up and you will feel like you're having a heart attack. It's just next to your heart, top it, because the gas will rise up and gas will get trapped in the transverse colon and blow up your splenic flexure area and the hepatic flexure. You might feel like you're having a gallbladder attack. Again, this is like a simple advice, but always check with your GP, with your doctor, because what I'm trying to say, that do not just do this just because I'm telling you to do. I'm a gastroenterologist. I've been a doctor for 30 odd years, and my passion is to teach patients simple hacks which can, make their life much better. Because most doctors, even gastroenterologists, dietitians, will not tell you this because they don't know about this, most of them. But my friends, good ones, they all know about this. And remember, Epsom dump. That's the thing that I coined. Later, when somebody tries to copyright this, this is my proof. Take an Epsom dump. Sunday. Either once a month, every Sunday, or alternate Sunday, or every third Sunday, or every fourth Sunday. You decide the frequency. Okay? Have a lovely, lovely day, and never ever forget your coffee. 2 cups is a must according to British Liver Trust. Freshly brewed coffee, not instant coffee. That's not very healthy, okay? And when you drink coffee, drink proper caffeinated coffee, not decaf. That's sham. That's not proper coffee. Anyway, take care.